present students. Let's remember a few main biophysical properties which provides direct current operation. Electroconductivity, it's a basic ability of tissues to carry out an electric current. This property depends on contents of fluid or water in different tissues and depends on cooperative resistance of tissues. It is so-called impedance, cooperative resistance of tissue. And the impedance described in electroconductivity depends, as I said, on contents of water. Then it is more than its impedance of concrete tissue less. So the tissue with major water content and so with a low impedance are blood, lymph, cerebrospinal fluid, urine, muscles, skeletal mostly, liver, and kidneys. These organs have high electroconductivity. Tissues with lower electroconductivity due to minor water content and high impedance level are osteal, nervous, tendon, corneal stratum of dry skin, nails, hairs. Here you can see famous for you biophysical processes from course of medical physics on the first year of education. 4 kinds of electric current associated reactions in different tissues: electrolysis, electrodiffusion, electroosmosis, and polarization. As for biophysical mechanism of action, electric current, operation of direct current between electrodes, we can create a constant electric field. Polarization forces enlarge resistance of tissues and can reduce weakening of current passing through tissue. Processes of diffusion and osmosis can promote alignment of an ion concentration. And the electric field calls moving ions and composite molecular tissues as well as particles of water. As for local changes, physical chemical changes under influence of direct current, we can detect local hyperemia on the electrodes due to derivation of histamine, acetylcholine. Amplification of metabolism regeneration, resorption of fabric decay product, tissues product, a rising of vessels walls permeability, and so improvement of microcirculation and amplification of common responses of an organism. So general stimulation of different metabolic processes. The operation of direct current is not restricted to a place of its position. So maybe more far effects we can recognize after this procedure. After short-term spastic structure may be first component of effect of stricture of bloody capillaries. There occurs the extension, second phase, vasodilation, rise of permeability and improvement of lymph and blood flow, and also stimulates the process of resorption. Direct current also can stimulate secretory and evacuatory function of gastrointestinal tract, especially after patients with problems with intestinal peristalsis. It's important after surgical operations. Let's remember most famous phases which studies electricity, famous scientists. Luigi Galvani, it was created the theory about electricity. He also was anatomist and obstetrician. His name was used for first most simple procedure for electric current application, galvanization. This application with medical purpose, energy of electric low voltage current up to 80 volt and small current intensity up to 50 milliampere, of course with therapeutical purposes. Here you can see the picture which demonstrates the Russian modification of so-called stream 1. Stream 1 is in comparison with electric current as stream. Here you can see the regulation, special scale for regulation of intensity of current by this hand regulator. Which effects galvanic current or galvanization we can achieve? This current gains by rectification and smoothing out of a variable network current. This current stimulates biologically active substances, allocation, activation of enzymes, metabolic processes. Also this method can improve strength, circulation, lymph flow, raises reparative ability of tissues, and improves metabolic and trophical processes, and secretory activity of glands, and also causes analgesic operation, analgesic effect. Now let's enumerate main effects, main groups of indications when we can apply successfully galvanization in medical practice. We can apply it for regulation of main nervous processes, for so-called psychosomatic disorders such as neurosis, peptic ulcer, essential hypertension. We can stimulate by galvanization different vegetative functions for patients. It's important for patients with migraine, bronchial asthma, solar plexitis, vasculomotor rhinitis. This current provides stabilizing action on these functions. For patients with intensive pain syndrome, we can also successfully apply this method for patients with neuralgia, for example, trigeminal neuralgia, neuritis of any nerves, facial nerves neuritis, for example, neuromyositis, and restoring and decrease of secretory and motor digestive disturbances, digestive system disturbances due to high spasticity of smooth muscles, which can cause dyskinesia of biliary tract or dyskinesia of intestine and spastic colitis. For achievement of trophic processes improvement, we can recommend galvanization for patients with atrophy or dystrophy of muscles due to, for example, long immobilization or due to congenital abnormalities of muscle trophicity. Also, we can recommend this procedure for patients with peripheral nerve traumas and for patients with poliomyelitis. As for contraindications for this procedure, galvanization, there are systemic blood diseases with, for example, microbleeding, acute inflammatory infectious processes with fever, psychopathia or psychosis, serious forms of neurosis. Irritable effect of electric current can provoke the exacerbation or negative reactions for patients. Acute form of cerebral atherosclerosis also is not recommended for application galvanization, and chronic ischemic heart disease accompanied with stenocardia. And of course, patients with severe cardiovascular system disorders such as myocardial infarction. Other diseases when application of galvanization is not recommended: arterial hypertension, third stage, vegetavascular dystonia accompanied with arterial hypotension, decreased BP less than 110 millimeters mercury. Acute form of cardiovascular and pulmonary insufficiency, thyrotoxicosis, thrombophlebitis of peripheral veins, of course, and tendency to bleedings, and of course, the general contraindication, neoplasms as malignant, and as well benign. It was the common contraindication for galvanization. Now you can see so-called in the list of short list of individual contraindications for galvanization. This list includes individual intolerance of current, so-called electric allergic reaction, damages and diseases of skin, trophic disorders, and acute purulent inflammative process. Here you can see furunculosis, multiple furuncles on the skin. As for skin diseases, especially diseases with itching syndrome are not recommended, such as psoriasis and eczema. Drug electrophoresis. Next procedure, which we'll discuss now, it's a combination. It's therapeutic treatment which combine effect of direct current and medicinal substances introduction. This procedure provides local action at the localized pathological process. Usually used small doses of medicines, small concentration, for example, 3–5%, not more, and small amount. Amount of substance is proportional to current intensity, square length, and duration of procedure, which contains usually around 20–30 minutes. We can apply transversal and longitudinal positions of electrodes. Longitudinal, both electrodes on one side of body, for example, along both sides of vertebral column. Transversal positions when we can apply one electrode, when it can location of first electrode on the chest and second electrode on their spine surface. It's called transversal position, which can provide more deep penetration of electric current, more deep effects for treatment of more deep organs diseases. And also we can divide so-called active electrode is more large and fissile is less on square. Passive, and fissile. Which biophysical processes we can stimulate in tissues recently for electrophoresis? We can cause change of membrane potential of cells and change ion concentration. So we can change excitability, amplification of metabolism, osmosis diffusion, generalization of nervous impulses, derivation of free radicals in diaphragm of nervous filaments. Main advantages of electrophoresis in comparison with other methods of medications introduction. Main indications are a combined operation of direct current medicinal substance can help to decrease concentration of medication. Local action on the localized pathological process and small dose of medicinal substance, which can help to avoid allergic effect. Durable effect of medicinal substance, because it's releasing from the pot in subcutaneous layer. As I said before, amount of substance inlet into an organism is proportional to current intensity, square length, and duration of the procedure. Main indications for electrophoresis are lesions of peripheral nervous system, polyradiculitis, radiculoneuritis, plexitis, neuritis, neuralgia of different location, trigeminal, intercostal, facial nerve, vertebrogenic radiculitis, cervical osteochondrosis with compression of cervical nerves. And after effect of wounds and other injuries, peripheral section of nervous system. In traumatological practice, we can successfully prescribe and use electrophoresis for patients with traumatic and orthopedic arthritis, bursitis, tendinitis, meniscitis, poorly resolved hematomas, commissures, psychiatrics, muscle atrophy, contractures of muscles, osteoarthrosis, calcaneal spur, and some other pathological conditions, and for some forms of rheumatological diseases, such as rheumatoid arthritis, gout, brucellosis, and etc. In gastroenterological practice, application of electrophoresis can find for treatment chronic gastritis, especially atrophic gastritis, for stimulation of gastric cells secretion, peptic ulcer, duodenal cholecystitis, especially with dyskinesia of biliary tract and intestine dyskinesia. In pulmonological practice for treatment of pneumonia, bronchitis, and bronchial asthma, we can apply successfully. Gynecological practice. This hormonal and chronic non-specific inflammatory diseases of female genital system, genital organs, chronic salpingo or oophorytis, and commissural disease. In urological practice for subacute and chronic prostatitis and for cystitis. For dermatological patient, dermal pruritus, we can suppress by any drugs. And neurodermitis. For patients with otorhinolaryngology, laryngology, patients with rhinitis and sinusitis, chronic tonsillitis, pharyngitis, laryngitis, otitis, even Meniere's disease with vertigo, dizziness, and neuritis of auditory nerve. As for individual techniques of galvanization, we can call galvanization collar zone on Sherbach, galvanization on the face for patients with, for example, trigeminal neuralgia, Barber-Gonier, common electrophoresis, and 4-chamber bath. for chamber bath for extremities. For extremities, upper and lower extremities for improvement of microcirculation. For patients with diabetes mellitus, for patients as for constant impulse current, this current characterized by temporary deviations of power, density of power from some constant value. Action, medical action depends on physical properties. Allocation of current and impulse distinguish. Rectangular, triangular, exponential, and other forms of impulses typical for impulse current. We can measure frequency of impulse in 1 second. The units of measurement is hertz. One of most popular methods of impulse current application is electrosleep or electrodream therapy. It is a method of local action on central nervous system, impulses of electric current, low frequency and small force. For obtaining a weak rhythmic stimulus causing inhibition in cortex, transferring in dream, and utilizes impulse direct current with a rectangular form of impulses, low frequency, small force, and stationary value of polarity. On this picture, you can see device and special rubber mask, as you saw on previous slide, which usually should be located on the patient's eyes. This is our first pair of electrodes, orbital electrodes, second pair connected with processus mastoid, located on processus mastoidus, occipital pair of electrodes. So 4 electrodes for this procedure. And this is a generator of these impulses. For example, for patients with functional disorders of central nervous system or with neurosis and hypertension of early stage or sleep disorders, insomnia, for example, we can recommend a range of frequencies between from 40 to 80 and 220. Current intensity can regulate individually from 30 minutes. From 30 minutes, it's minimal duration of procedure till even 2 or sometimes 2, if possible, 4 hours. If patient sleeps, we can this ability to sleep more deep, if possible. Course of procedures includes 10-15 procedures. Very popular procedure, especially for women and child. Mechanism of operation electrosleep electrodream therapy associated with direct and reflex influence of impulse current as a weak arrhythmic stimulus of subcortical derivations and cortex of brain. A doctrine about parabiosis was elaborated by Professor Vidensky. So, by inhibition of cortex activity, we can simulate and stimulate the process of parabiosis, deep rest. Effects of electrosleep therapy procedure. It normalizes emotional activity of patients. So for patients with peptic ulcer, combustions, cardiology, we can achieve analgesic, soft analgesic effect. Vegetative functions we can improve also by electrosleep therapy for patients with migraine, for example, for women with migraine. And also this procedure normalizes basic metabolism and level of blood glucose and activity of central nervous system. Main indications of this procedure are neurosis, post-traumatic states, essential hypertension, and atherosclerosis, peptic ulcer, bronchial asthma, rheumatic arthritis, dermatosis, neurodermitis, with itching syndrome, which can lead to sleep disorders, to insomnia. And note your attention, even gystosis or preeclampsia of the pregnant woman associated with hypertension. And for correction of pregnant woman hypertension, we can successfully apply this procedure without any side effects on pregnant woman and her child organism. Without. Absolutely. As for contraindication, which we should estimate before prescription of this procedure, there are intolerance of any electric current, inflammatory diseases, as you can see, the syndrome of so-called red eye, inflammatory disease of eye, conjunctivitis, keratitis, cataract, trophic, and glaucoma. Dermatitis of face, especially in place of electrodes location, near with or orbital zone. Traumatic arachnoiditis with liquid dynamic disorder, also not recommended or even contraindicated. Hemorrhagic stroke, wet eczema in the face, and now the attention presence of metal foreign bodies in the area of exposure, because it can lead to dislocation and heating effect on this metal construction, the metal bodies, and hysteria. Hysteria as a specific, most expressed form of neurosis. And there's one example, this impulse current we'll discuss now, diadynamic currents or Bernard currents. This current we can apply in two forms, semi-sinusoidal form of the impulses with frequency 50 impulses in second and 100 impulses in 1 second, two-stroke and spot undula. Continuous current. Spot continuous current can lead the frequency 50 Hertz Irritation can cause irritation of muscles. So stimulation of contractility. Two-stroke continuous current, semi-sinusoidal form, provides mild vibration and largest electric conductivity of skin and provides analgesic effect, taking out pain and spastic stricture for smooth muscles, especially smooth muscle spasm. Possible combination of spot and two-stroke currents alternate through 1 second. Main indication to this procedure: different traumas with pain syndrome and lesions of peripheral nervous system, polyradicular neuritis, radicular neuritis, plexitis, and cervical osteochondrosis, and others. Essential hypertension for vasodilative effect and for decreased blood pressure. Atherosclerosis of extremity vessels, also by we can improve blood flow, peripheral blood flow. Atonic or spastic colitis we can correct by this current. Raynaud's disease and Bacter's disease of ankylosing spondyloarthritis. And sometimes maybe effective application in gynecological practice. Note your attention, especially for a woman with chronic salpingo oophorytis and commissural diseases in fallopian tubes. Contraindications. Among contraindications for this procedure: fractures with immobile fragments, cholelithiasis and urolithiasis, because intensive impulses can lead to can stimulate dislocation or movement, internal congruence. It can lead obstruction or mechanical obstruction, and with fever, with further jaundice and urinary stasis. So it's very